experts in the UK are now looking at the possibility that a new strain of the Delta variant of the COVID-19 emerged. Now, this is according to a report in iNews. After attending a 53,000-person festival in Cornwall, the town experienced a sharp spike in cases among young people, the youth. So now, a senior official working on pandemic response in the southwest of England said that many of the infections among young people in the region had been identified as coming directly from the festival in the UK, which now has the highest rate of infection in England at more than 2,000 per 100,000 people, according to this report. So now, okay, a new strain of the same variant, right? So look, the Delta variant is now the main COVID-19, right? And so that's the thing that is spread around the most. It is the dominant strain. And so now you have offshoots of that strain, and of course, mutations and things like that. It gets complicated. But let me just say, evolution is a funny thing. Apparently, scientists were able to track changes in the Delta variant by looking at the genetic evolution of the code. So, look, this is like Science 101, okay? But apparently some people need this because they didn't pass Science 101 or, 8th grade science or, oh, hell, probably sooner. I don't remember when I learned about this, but it was a long, long time ago. When a cells divide, right, there is a chance that mutations, the more cell division, of course, happens, the more chances there are of mutations. Some mutations beneficial, some are not, and those less beneficial strains and variants tend to die off and are replaced by new ones. Again, very basic stuff, right? So now, this new strain of the Delta variant, hospital staff are referring to now as the festival variant, which again, it's technically not a new variant, but there's a lot of confusion around medical terms, okay? Simply put, though, a strain is a variant that is built differently and so behaves differently to its parent virus. The behavioral differences could be subtle or it could be obvious. For example, these differences could involve a variant binding to a different cell receptor or binding more strongly to the same receptor as the previous strains, or replicating more quickly, being more contagious, or transmitting more efficiently, as I just mentioned, and so on and on. Okay? Now, essentially, when it boils down to it, all strains are variants, but all variants are strains, if that makes any sense. Okay. Now, the official added, it's still the Delta variant, but they can say that it came from the festival, hence why it is being called the festival variant. And so that's where they're thinking that this developed at. The Southwest Peninsula is now home to 8 of the top 10 areas in England with the highest rates of infection, said the report. Those figures also show that around half of all infections in England are among young people, as I mentioned, young people under 30. In fact, the highest rate of infection is now in the 10 to 19-year-old age bracket. So think about that. Think about that. Remember, people under 12 cannot get vaccinated. Younger people are less likely to be getting the vaccine, obviously for other reasons. People between the ages of 12 to 19 are not getting vaccinated. And again, there are various reasons for that, many of them dumb. In fact, here is Professor John Drury, a member of the Government Scientific Pandemic Insights Group on Behaviors, saying this about young people's tendency to go to mass events without masking and, in many cases, also not being vaccinated. He said this, different mass events have been found to be associated with very different rates of infection, and one factor explaining this is crowd culture. The Government Events Research Program noted that fan behavior at the Euros was very different than in Wimbledon. for example, and we can expect a greater physical intimacy, touching, close interaction, hugging, sharing drinks, etc., at a music festival than at other large events. One of the key reasons that some people are engaging less with these basic protective behaviors is that the government has basically said, it's safe now, it's fine, you're not going to die. And of course, that government is under Boris Johnson. So, yeah. Now, the problem, of course, jury ended up saying, in wrapping this up, saying, the problem is, of course, that 100 people a day are dying. We need to support new norms around safety at festivals. So understand that this is still happening. New strain, not good. And that's really kind of the problem with letting viruses propagate. You get the new variants, you get the new strains, you get enhanced transmissibility, and in some cases, enhanced lethality. Not good. That's why it was really best to head this thing off early on by, doing the lockdowns, doing community masking, and then, of course, when you had the vaccine, mass vaccination. But it is obvious to me that we can't count on everybody to do the right thing. Okay? I mean, especially not only for the community, but of course for themselves. They won't even do the right thing for themselves. You have conservatives here and abroad that are screaming about freedom because their server at Applebee's decided to wear a mask. I think that's more of an American problem, but you know what I mean. And those same people are clogging up the medical system now because they're getting COVID. 90 to 95% of all COVID cases, I'm sorry, not cases, but hospitalizations are among the unvaccinated. They also, again, unsurprisingly, don't wear masks. And they flout COVID safety suggestions. And that's why I think policymakers have to make a tough choice. We need federal mandates. What do I mean by that? Now, I'm not going to federally mandate somebody coming to your house and jabbing a needle into your arm. We can't do that, obviously. But we should do something for flying. You want to fly? Proof of vaccination. Or if you want to go into a federal building, have to be vaccinated. That's it. Private businesses could also be assessed additional taxes for not mandating masks at their establishments. On the grounds of it being a public health hazard. I mean, think about it this way. We already have public health hazard laws on the books. We already have, restaurants that can get fined for having dirty kitchens, right? And again, things like that are enforced. You have, you have to have employees that wash their hands before they serve food. You have to run a clean kitchen. You have to have a clean dining area, or else you get fined, or else you get something. And this could work the same way. And the point of it all, and here's the real point, and I'm going to be honest about it. This is to make life so annoying for people who do not mask and who do not vaccinate that it'll wear them down to the point of, okay, fine, I'll get it. You have to, because that's how you eradicate the virus. You have to get everybody on board, as many people as you can. And once we do, and get rid of the virus, then we can all go back to life. And look, here's the thing too. Unfortunately, not as many people care. Look, around 1,000 people a day are dying from COVID-19. And it is really hard to convince people, other Americans, to care, because after all, we do live in a country where 68,000 Americans die a year because they can't afford medical care or prescription drugs. So we live in that culture, which just allows people to die because they can't afford health care. And you have people arguing against universal health care, against Medicare for all. So it feels like this is here in America, it's an extension of our culture, which is extremely individualistic, which sucks when you have something where you have to get everybody on board to actually do something for the good of everyone else. Pretty much impossible to do. By the way, 68,000 Americans, according to a Yale study of epidemiologists, who found that Medicare for All would save around 68,000 lives per year and would reduce U.S. healthcare spending by around 13% or $450 billion a year. So I'm just saying. So my point is, though, when you live in a country where you're kind of used to mass death, that is entirely avoidable, and that's not counting gun deaths in this country, which again, most of them are pretty avoidable. We actually had decent gun laws. Then you just don't even care to do the bare minimum to save your fellow countrymen and women. So that's unfortunately the culture that we live in, and seems to be the way that the UK is going as well. And what sucks about that is usually when a new variant pops up in the UK, it ain't long until it ends up here. If you enjoyed this video, please give us a like and share with your friends. You can subscribe and help out the channel by becoming a patron. It's patreon.com/Jeff Waldorf, or you can become a channel member as well by hitting the join button below.